Hello, I'm Dr. Beth Colby from YouTube channel Talk Mental Health. I'm a psychiatrist in London. Last week, The Independent reported that doctors and nurses will need treatment for post-traumatic stress disorder and that they are struggling both physically and mentally to work in distressing conditions, often with a lack of vital equipment. A lot of NHS workers spend hours in hot conditions wearing the full protective gear, trying to keep up with demand. Dr. Alison Pittard, the Dean of the Faculty of Intensive Care Medicine, said this, and I quote, "I'm really concerned about the toll this is taking and will continue to take on staff. We are used to dealing with emergencies, but we have never been exposed to this sort of demand." She went on to say that the government's approach to flattening the peak will spread the cases of coronavirus out, but that means that staff will need to work for a longer period. She said that they will get through this because that is what they do, but there were some people, both patients and staff, who will suffer forms of post-traumatic stress disorder, and that some staff may continue working with mild symptoms, not being aware that they have them, and that this may make them worse. She said that we need to consider staff well-being in the future. She said that there's no doubt that in some situations safety will be compromised, but that people have to do the best they can. Dr. Dan Martin, the head of intensive care at the Royal Free Hospital London, said in a memo online that most intensive care units have gone from a ratio of 1 nurse to 1 patient to 1 nurse to 6 patients, with 1 support worker with each patient. He said that some units are using whatever staff they can, from medical students to dental hygienists. He said that training has become way down on the list of priorities. It is too large a task and that people are being trained on the job. He said that the staff have been doing a remarkable job with extremely tiring, stressful and challenging conditions for every hour of every day. He said that the NHS has never been stretched as it is now, but the spirit of the NHS has never been more evident or valued, and that National Health Service workers, from nurses to porters to cleaners to clinical staff and leaders, are doing their utmost to look after the patients, sometimes even at the expense of their own health. Thank you for listening. Goodbye for now.